Welcome back to Fox 51 today. Heart disease still the #1 killer in America, and Dr. Pitonak from Trinity Clinic Cardiology is here to tell us how to make 2013 a heart healthy year for everyone. Doctor, thank you so much for being here with us. We've heard about the new heart hospital there at Trinity Mother Francis and everything. And so tell us, part of the new hospital's mission is education. So what are some of the tips that you can give us for 2013 for families?
Well, we are in a pre-Christmas time, so everybody is going to eat more than they're supposed to. So
right.
Maybe it's a good time to mention what we should really do. Everybody knows what to do in majority of times. We just need to remind people because we tend to forget because we don't want to think about the healthy stuff because it doesn't maybe taste as good.
Right.
It's a lot of vegetables, fresh vegetables, fruits. We should avoid processed food. When we choose the meat, needs to be lean meat. We should try to avoid fried food. So all the things that you hear when you go to doctor's office, you really should follow because it does work.
And then, you know, after the new year, one of the biggest things is lifestyle. Talk about a little bit about exercise and how that affects our cardiac health.
Exercise is very important. The current recommendation is to exercise at least 30 minutes, 5 to 7 days a week, because it does show in the studies that if you exercise on a regular basis, it decreases the risk of diabetes, high blood pressure. If somebody has high blood pressure, it decreases the blood pressure, so you can get rid of maybe some of the medications you take. It decreases the risk of heart attack, stroke, so it is important to do it on a daily basis.
And we're also busy with exercising. How often do you expect everyone to exercise? Should they do it daily, and how long every day should they exercise?
It should be every day. As I said, recommendation is 5 to 7 days a week, 30 minutes at least.
30 minutes a day.
It is at least that, yes.
Okay, what about family history? How much of a role does that play?
Family history is an important risk factor that we unfortunately cannot influence, but if you know that somebody in the family has heart disease or diabetes, you know you have a higher risk of developing those, so you have to be even more vigilant about the diet and healthy lifestyle.
And we just had the ribbon cutting of the Lewis and Peaches Heart Hospital there at Trinity Mother Francis. I know you guys are really excited about that. Talk to me a little bit about what this new hospital is going to do for you guys and what kind of new procedures you can offer the East Texas area.
It's really high-end facility that you would have a hard time to find throughout the United States. Not only that it's a new building, but it's a design in a way that, let's say, Trinity Clinic Cardiology, we're going to be in the building, so we can see patients in the office and at the hospital at the same time. It's not only about equipment, but we're trying to do the highest standard of care we can. If you look at our rules, what we follow, we really want to follow all the studies and all the research that was done and follow everything that is recommended to help the patients the best we can. There is also a rehab center downstairs, which is beautiful for patients after they have had cardiac events to go back into normal life as soon as possible. It is just an amazing facility. If you didn't come to visit, you need to at least come and visit and see us. On the other hand, we are talking about preventive health care, so we want to do everything we can so you don't have to go there actually.
Right, so maybe just come for a visit to see it and not have to stay. Well, Doctor, thank you so much for being on, and hopefully everyone will take those tips and have a heart healthy 2013. Coming up next here on Fox